Hello everyone, welcome back to Radio Buzz. This is Dr. Anju Verma. Today in this short video, we are going to talk about osteochondritis dissecans. So it is a condition where there is subarticular post-traumatic necrosis of the bone. Usually this condition is seen in young males more commonly and more commonly in athletes. So what happens here is due to direct trauma or maybe due to accumulation of micro trauma over the time, there is a osteochondral defect in the bone in the subarticular area, and because of that the patient may have pain. So first of all, X-ray. Coming to X-ray is really non-specific for this condition, and sometimes it may be unremarkable and sometimes it can show you a subchondral defect, like here we see in this case. So this is the femur, this is the lateral condyle, this is the medial condyle. Here we have the proximal part of tibia, this is the lateral tibial plateau, medial tibial plateau, and here we have the fibula. So on the lateral aspect of medial femoral condyle, we see there is this subarticular defect. So then coming to the MRI sequences, MRI is more precise as it can show you directly the affected bone, and it can also precisely tell you the stability of the osteochondral defect, whether it is completely stable, it is incompletely attached, or it is completely detached. Okay, so if the fragment becomes completely detached from the parent bone, then it can become a loose body inside the joint space, and ultimately it will lead to secondary degenerative changes, okay, osteoarthritic changes. So what we see here, we have this is the lower end of femur, this is the lateral condyle, this is the medial condyle, and here we have the proximal part of tibia, the lateral tibial plateau, the medial tibial plateau, and here we have the intercondylar notch. Okay, so this is a 17-year-old male who presented to us with knee pain and a history of trauma few days back, and after that trauma he was continuously having pain. So on MRI sequences, this is T1 sequence. So here the joint fluid is synovial fluid is black. So here we can see there is this osteochondral defect, but however the articular articular cartilage is intact, and we see the marrow edema surrounding the defect. So on stir images we can see the edema better. So here we have this is the articular cartilage, and here this is the defect, and this is the surrounding marrow edema. So here we can see this is the edema, this is the bone defect, and it is appearing hypo intense on all sequences. Here we can see there is no loose body inside the joint. Okay, so this defective fragment is completely attached to the bone, and there is no definitive fluid signal between the defective bone and the parent bone. So this is a stable fragment, and what we supposed to do, how do we manage these kind of patients in cases of the fragment is stable? We can follow it up, and we can wait for the healing on by itself on conservative management. If it does not heal and if the trauma keeps going on, there may be complete detachment of the bone fragment from the parent bone. So in those cases we might need to intervene surgically. What surgeons can do, they can drill this fragment so that there is increased vascularity and it will get the nutrition and will heal on its own, or they can directly reattach this fragment to the parent bone. Thank you.